One night, while working in the ER of a level 1 trauma center here on the south side of Chicago, I was attacked by a psych patient who was convinced that the patient next door was her husband. He was not. And it involved a scuffle that ended in my knee being injured. This caused me to have 6 weeks of physical therapy along with a nice knee injury and a lot of time off of work that I didn't plan on having. And as a sole provider for my household, that kind of definitely affected my financial situation. So it was kind of a blow when the management's response was, "What could you have done differently?" According to OSHA, over 70% of workplace assaults occur in healthcare. And healthcare workers are 5 times more likely to experience violence than any other profession. That's why these crimes against nurses should be considered a criminal offense. In doing so, we will protect our healthcare workers, we will improve patient care, and we will create a safe environment for healthcare workers to deliver patient care effectively and without having to worry about watching their back. I personally have done extensive research with the American Nurses Association, the Emergency Nurses Association, and OSHA. I have also witnessed firsthand violence that can occur in an emergency room on a daily basis. I have worked in the ER for over 9 years and have personally witnessed this quite a few times. The American Nurses Association and the OSHA, as well as the Emergency Nurses Association, are all pushing for stricter laws to criminalize acts against healthcare workers. It's important to understand that this violence is very serious and very under-discussed. I will identify the issues of the system failures and propose real policy solutions. We need to criminalize these acts and protect our workers. The problem with this is that the violence is too widespread and too underpunished. Many nurses don't report the acts that occur because they're so used to it and it occurs so regularly. The offenders are rarely prosecuted. According to the NCSL, charges are often dropped or treated minor. There is also the lack of administration support. Instead of asking, how can we prevent this from happening, the question is, what could you have done differently? With an understanding of the problems that nurses face, along with other healthcare workers, being that the violence is rarely prosecuted, the administrative support is minimal at best, and underreporting is extremely common. We must focus on why it is so widespread and so underpunished. The legal system doesn't seem to take violence against healthcare workers seriously. As of 2022, only 38 states consider it a felony to assault a healthcare worker. Hospitals seem to prioritize their patient satisfaction over their employee safety, which discourages staff from reporting for being fearful of being complained on or reported against. In reality, they're just defending themselves. There also is the fact that patients that come in with mental disabilities that are either intoxicated or psychiatric patients are not being held accountable for their acts. And so the violence just becomes expected and excused and repeated. So now that we understand the role that the legal system is playing by allowing the violence to keep occurring, by not enforcing felony charges, the hospital prioritizing guest satisfaction and 5-star ratings over employee safety, and by the administrative accountability failures, it's pretty clear that we need solutions and we need them now. Next, we're going to talk about some national and personal strategies that we can enforce to push healthcare violence to be criminalized and be treated more seriously. Attacking healthcare workers needs to be criminalized. I've said this and I'll keep saying this. Federal law should require felony charges with no exceptions to mental capacity, to what their alcohol level was at the time. If they were on their meds, people need to be held accountable for the things they do. And the hospital needs to stand with their staff. They need to provide the documentation. They need to have the legal support for them and pursue charges against these people to show their staff they support them and to show the community that this is zero tolerance for violence against healthcare workers. And on a personal level, we can be trained to handle these types of patients with combative patient training and ways to talk to psych patients and implement different strategies to implement different strategies to work with these patients to be able to deliver care and still be safe while doing so. So we can also reduce the risk by enforcing a zero tolerance culture, report what happens, and make sure that it doesn't happen to anybody else, and reduce the number of occurrences every year. We need to support and advocate for laws to protect our healthcare workers. So today we explored the issue of violence against our healthcare workers. We know that it is how widespread and underreported it is, how the legal and institutional causes that have been enabling it, and the real-world solutions that require federal law reform, as well as administrative support, cultural change, and ensuring safety for nurses and as well as healthcare workers, and accountability for the public that they serve. Nurses are the backbone of healthcare, yet they're treated as disposable. According to the American Nurses Association, no one should face violence doing their job, and I think that's a fact that we can all agree on. So remember my story where I was attacked in the ER on a regular night at work. It's not rare. It's quite common. Don't forget, over 70% of violence in workplace situations occurs in healthcare. It's not a number, but a call to action.